welcome to Health Dialogues. I am Dr. Nandita Mohan, and 19th of April every year is commemorated as the World Liver Day. Now, this is a vital occasion which is basically aimed at raising awareness about liver health and also to understand the prevalence of liver diseases worldwide. Despite its significance, the liver health often remains neglected. So, to talk to us on this World Liver Day, we have with us today Dr. Aswin Krishna, who's a top hepatologist and leading transplant physician in Tamil Nadu. He is ranked as the #1 liver expert in Chennai. After completing his MBBS from Kanyakumari Government Medical College, he obtained his master's in general medicine from Madras Medical College. He then did a Doctorate of Medicine-Hepatology at Madras Medical College, and further on went to do a fellowship in liver transplantations in Rela Hospitals, Chennai. He is also an intuitive certified in Observership in liver transplantation training. So welcome to Medical Dialogues, sir. It's really a pleasure to be interviewing here today at Medical Dialogues.
Thank you for inviting me. Thank you. I got a good opportunity to share my thoughts also.
Great, thank you so much, sir. So now, if I may, we are commemorating World Liver Day today. So if you could just give a small brief about what are the common liver diseases that are occurring globally and what basically are their risk factors.
There are commonly more than 100 liver diseases. In that top 75% to 90%, most liver diseases are due to three causes actually. One is due to alcoholic liver disease. Second is a viral hepatitis, mainly due to hepatitis B and hepatitis C. And third, emerging, which is surpassing the previous two, is the non-alcoholic fatty liver diseases. So mainly, as the name suggests, the top alcoholic liver disease, the main risk factor is overuse of the alcohol, and hepatitis B and hepatitis C virus infection. The main risk factors are IV drug abuses, blood transfusions, tattooing, and dialysis even can transmit this hepatitis B and C infections, homosexual practices, unsafe sexual practices. These all are the risk factors for this hepatitis B and hepatitis C. For fatty liver, the main risk factors are overweight, obesity, hypertension, cholesterol, dyslipidemia. These are the risk factors.
Great. That's a good introduction about what major liver diseases one must encounter or one must look forward for. So can you explain the importance of the early detection of these liver diseases that you just enlisted out, and also the treatment in what are the basic treatment in managing such conditions?
Okay. See, most of this liver disease, the beauty is most of the liver disease doesn't come in a day or in a week or in a month. Most of the liver disease are inside us, which progresses from years. It takes years to progresses. For example, most common is fatty liver. It takes almost 10 to 20 years to become the full-fledged liver failure. So early detection is very important. Initially, it starts as liver fibrosis, fatty liver, then it progresses to liver fibrosis, then it goes for cirrhosis, and then liver failure. This entire process takes 20 years. If you are able to detect the disease at liver fibrosis level, you will be able to reverse at 100% without any transplant or without much expenses. By just medications and lifestyle management, you will be able to reverse it by 100%. That is the beauty of early detection of liver diseases. Another example is liver cancer. If you are able to detect it early, you will be able to completely cure by a single day treatment. Meanwhile, if it is very late stage, then it will be a difficult ups and downs.
So just to summarize, it all actually comes down to early diagnosis, and only then a prompt treatment can be administered. So if a patient is well aware about the condition and gets detected, the condition gets detected early, then it's definitely going to be beneficial for him. Right?
Yeah, correct.
Yes. So now you were also talking about early. Now that we're talking about early detection, you also even mentioned about lifestyle changes. So if you could just enlighten us on what lifestyle changes can individuals actually make to maintain a very healthy liver and also prevent the occurrence of these liver diseases. What lifestyle changes can you list out?
So first point is avoiding alcohol. My advice as a hepatologist is completely stop alcohol. Even small amount of alcohol is dangerous. So avoiding alcohol. Second, by my experience, if you are able to have exercise or simple walking 30 to 45 minutes a day, 80 to 90 percentage of the liver disease you will be able to prevent. So walking. Number three, avoiding junk foods and carbonated drinks is a major role. Lot of incorporating vegetables and fruits, and routine screening for liver disease who are at high risk. These are the better lifestyle management that will help for the prevention of the liver diseases.
Yes, very well said. Actually, one has to definitely get these incorporated into their day-to-day lifestyle changes that need to be done to benefit their health. Overall health also will definitely benefit from this. Now, coming to the diagnosis and the treatment aspect of the liver diseases. So, if you could just give us a detail on what advancements have been made in that aspect in the recent years.
Before 5 to 10 years, when I started my MBBS, there was not much treatment in the liver diseases. But nowadays, after 15 years, you have almost 90 to 100 percentage treatment in most of the liver diseases. For example, hepatitis B and hepatitis C, 10 15 years, there was no cure for the hepatitis B and hepatitis C. But now, with the advance of medicines, there is 100 percentage cure for hepatitis B and hepatitis C. Therefore, by if you take prompt treatment at the right time, you will be able to reverse it 100 percentage. Number one. Number two, there was no new methods for detecting this fatty liver. Only you can see ultrasound showing some fatty liver, and another 10 years patient ending up with cirrhosis. But nowadays we have an advanced investigation called fibroscan, which helps to know at what stage of fatty liver you have and what treatment you should do. Prompt treatment will help to reverse 100 percentage of the fatty liver. And previously we were not having any drugs for the fatty liver which can 100% cure. Now we have many drugs. Recently last month the FDA approved is a drug, and we have also other anti-diabetic drugs that helps to prevent almost 100% fatty liver. Similarly, in liver cancer, 10 to 15 years back, more than 5 centimeter liver, if the tumor is there, almost the prognosis was very grave. But presently, if the liver cancer has progressed even to the blood vessels, even if they have advanced liver cancer, there are much better drugs, chemotherapy, radiation, which can help to eventually completely reverse the liver cancer.
Great, great. Now, coming to the next aspect of the liver diseases that we're talking about, if I take about one aspect that you mentioned as alcohol consumption. So,
Yes.
how does alcohol consumption impact one's liver health? And if you could just pull out a statement saying what are the recommended guidelines for safe alcohol consumption, if there are any?
As I already told, according to me, even a single drop of alcohol is injurious. For various person, the threshold will be various. We don't know. That's why we recommend complete stopping of alcohol. What alcohol does is, alcohol increases the fat deposition in the liver, really leading to the further damage, leading to cirrhosis and liver cancer. If a person takes 6 drinks per day continuously for 2 weeks, he will 90% ends up in alcoholic liver disease. So as I told, any amount of alcohol is injurious to health. But many patients ask me, sir, unavoidably I have to attend some social conference, social meeting, social family get together where it is mandatory to use alcohol. How much a normal person can take? That is, the normal threshold is a person should refrain, if it is men, less than 3 drinks per day, and if for women it is less than 2 drinks per day. So normal person should always resist or himself to these levels. And if a patient already have jaundice, what is the safe limit? Once he have an alcoholic liver disease, Not even a drink is safe for him. Even a single drink can trigger advanced liver failure and results in catastrophic effects leading to death or liver transplantation. But latest studies says that if patient is having stage 1 of fibrosis, then he can have a one single drink per day. Patients more than having grade 2 fatty liver or grade 2 fibrosis should completely refrain himself from taking even a one drink of alcohol, which can lead to catastrophic effects.
That is one note I think everyone should take into account. There is no safe recommendation, if I would say, for alcohol consumption. It all comes with its cons with consumption. Now, the next aspect is we're talking about the link about various lifestyle parameters, one being alcohol. If you could just discuss the link between obesity, diabetes, and liver diseases, and such as if you talk about, you just mentioned one of the aspects, which is the non-alcoholic fatty liver disease. So, what is there that link?
So very interesting question, and yeah, I myself has shocked to understand know the data. Nandita, can you believe that almost 1 in 3 of every Indian adult population is suffering from fatty liver? And if a patient is obese, if he has a chance of having 70 percentage of fatty liver, and if a patient is diabetic, if he has 50 percentage of chance of developing fatty liver. If the patient is having both obesity and overweight and diabetes, he has 90 percentage of chance of getting fatty liver. In these patients, if we take alcohol, it is almost 98 percentage he can have fatty liver. That means every 1 in 2 diabetic patients have high chance of developing fatty liver. So why do this happen? This diabetes patients have high chance of deposition of fat in the liver due to the altered fatty acid metabolism in the liver, leading to formation of fat, leading to liver fibrosis, eventually leading to liver cirrhosis. So what these patients should do? How can they early screen? A simple test I will tell you, Nandita. Every person should take an inch tape that we use daily in our home. He should surround it, measure his weight circumference at the level of his belly, that is at the level of his umbilicus. And if it is more than 90 centimeter for men and 88 centimeter for women, then they are at high risk of having fatty liver. These persons should go to an hepatologist or a advanced liver hospital and get tested for fatty liver using fibroscan and other investigations. What these persons can do, a simple advice is a simple 2 tips to prevent fatty liver or reverse fatty liver is: first is, a overweight persons should reduce only 10 percentage of his body weight. For example, if I am 100 kg body weight, if I have an 100 kg body weight, if I am able to lose, if I am able to lose 10 percentage of body weight, that is 10 kgs in an year or 1 kg per month, then at the end of an year, I have more than 95 percentage of chance that I won't have a fatty liver, or even I have a fatty liver, it would have been reversed. This is a quick tip. Only if you reduce 1 kg per month for a 100 kg person, then you have almost more than 95 percentage of reversing or getting treating for fatty liver. Second tip is, a patient can have black coffee. 2 to 3 cups of black coffee has shown to reverse completely. It doesn't completely reverse, but it will help in reversing or getting treating fatty liver. Avoiding carbonated drinks and junk foods will help you to completely reverse fatty liver. And avoiding saturated fatty acids such as coconut oil, red meat, ghee will help you to reverse fatty liver.
So, primarily, if I could just narrow it down, the stats are definitely scary, the statistics that you just mentioned, and the tips and you just mentioned, those will be helpful. So, they are basically to curb down the scare that is created if one gets diagnosed with liver diseases.
Yeah.
You mentioned about all these parameters, if you could just give out a little detail on the diet aspect. So, what role does diet play in supporting the liver health, and or are there any specific dietary recommendations for individuals who are suffering with liver diseases?
So mainly the main advice for diet is avoiding the junk foods and like pizza, burger, and mainly the carbonated beverages which we are used to take in modern lifestyle. This should be first avoided. Second, as early I told you, taking 2 cups of black coffee without sugar, without milk per day has shown to completely treat fatty liver with other lifestyle modification. Number 3, avoiding rice or cutting down rice will help you to lose weight and thereby solving the fatty liver. Third, avoiding saturated fatty acids, which is commonly seen in palm oil, coconut oil, ghee, red meat, this maple syrup, fructose syrup, which was using in making cakes, should be avoided. And then what oil should be used in day-to-day practice? Using unsaturated fatty acids such as sunflower oil, olive oil, groundnut oil are helpful in preventing liver disease. If a person walks and accompany this diet habits, he has greater chances of preventing fatty liver.
Nice, nice. So, lastly, Dr. Ashwin, if you could just highlight on viral hepatitis. You mentioned that is also one part of liver diseases that is prevalent globally. So, how does that contribute to the liver disease burden, and what measures are being taken to actually address the hepatitis prevention as well as the treatment aspect?
So, mostly hepatitis B and hepatitis C. Hepatitis B is transmitted during birth. Actually, more than 90% is transmitted during birth. So screening of the mother during the pregnancy is the first step, and second, vaccinating the baby just immediately after the birth for a hepatitis B positive mother will help to prevent 90% of the more than 99% of the transmission from the mother to the child. Number 1. Number 2, adapting safe sexual practices. Number 3, proper screening of blood during the blood transfusion. Number 4, tattooing. Tattooing in the local streets should be avoided. In a certified centers should be adapted. Number 5, dialysis in after proper screening will help to prevent this transmission of hepatitis B and hepatitis C infections. And one important thing I want to tell is those who are at high risk, old age people should be who are at high risk of getting this hepatitis B and hepatitis C infections should be vaccinated for hepatitis B. There are vaccines. If you take 3 doses and check the titers, you will be able to 100% prevent the transmission of hepatitis B infection.
Great, wonderful, Dr. Ashwin. Thank you for joining us today.
One more thing I want to tell you.
Yes.
I want to spread a message to everyone that liver cancer is something that can be 100% treated if you detect early. So any one of the relatives are having hepatitis B, hepatitis C, or fatty liver or liver cirrhosis, these 4 high risk persons should be screened every 6 months for liver cancer, because with a single day treatment we can completely eradicate or treat liver cancer if you detect it early. But it late, then it may lead to catastrophic effects.
Noted.
That
definitely.
is my goal and mission, because I have seen 35 year old men having advanced liver cancer. He will be having 1.5-year-old child. There is no treatment. If it would have detected early, we could have completely treated liver cancer.
Very true, very true. Definitely, cancer is something which is really taking a boom over the years, and every other person, every other household is undergoing some patient is undergoing cancer treatment. So definitely, early screening, early, as you mentioned, if these diseases are detected at an early stage, people can actually go towards proper treatment, and it can be corrected. And as you mentioned, 100% reversal is also achievable. So
Yes,
definitely, if
yes,
that is achievable, then why not go ahead and get screened every 6 months? That
exactly.
should be the key takeaway message for every individual to undergo, because lifestyle changes, dietary changes, as all happened over the past decade. There is nothing which can be controlled over a period of time. Yes, one can control, but apart from that, screening is something which is definitely important.
Yeah.
So, thank you so much, Dr. Ashwin, for joining us today at Medical Dialogues. It
Thank you.
was lovely to be interacting with you today on this World Liver Day.
Thank you. Thank you so much. It was a very useful session. Actually, I could able to share my thoughts so that it will reach to more people.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.